Question 1. Governance review demonstrates that while telehealth service delivery is efficient, patient feedback indicates a perceived lack of personal connection during remote consultations. As a certified telehealth coordinator, CTC, what is the most effective strategy to proactively build trust and rapport with patients in this digital environment, ensuring they feel valued and understood? Option A. Rely on the patient to initiate personal conversation and express their emotional needs during the telehealth session. Option B. Limit communication to essential clinical information, using standardized scripts to maintain consistency across all patient interactions. Option C. Prioritize active listening, personalized communication, and empathetic responses to create a sense of genuine connection and understanding. Option D. Focus exclusively on the technical efficiency of the telehealth platform to ensure a smooth and uninterrupted clinical exchange. Correct answer is C. Prioritize active listening, personalized communication, and empathetic responses to create a sense of genuine connection and understanding. Explanation. Scenario analysis. Building trust and rapport with patients remotely presents a unique set of professional challenges for a certified telehealth coordinator, CTC. Unlike in-person interactions, the absence of nonverbal cues, physical presence, and immediate environmental context can make it difficult to establish a strong connection. Patients may feel more vulnerable or less understood when interacting solely through technology. The CTC must actively work to bridge this digital divide, ensuring the patient feels heard, respected, and confident in the care being provided. This requires a deliberate and empathetic approach to communication and engagement. Correct approach analysis. The correct approach involves proactively employing communication strategies that foster a sense of personal connection and understanding. This includes using active listening techniques, such as paraphrasing and asking clarifying questions, to ensure the patient feels truly heard. Personalizing the interaction by using the patient's name, acknowledging their concerns, and showing genuine empathy are crucial. Additionally, clear and concise communication, avoiding jargon, and setting realistic expectations for the telehealth session can significantly enhance patient comfort and trust. The CTC should also ensure the technology is used to facilitate, not hinder, the connection by checking audio/video quality and ensuring a private and comfortable environment for the patient. This aligns with ethical principles of patient-centered care and the professional standards expected of a CTC, which emphasize effective communication and patient well-being in the telehealth setting. Incorrect approaches analysis, focusing solely on the technical aspects of the telehealth visit without dedicating time to building rapport, is a significant ethical failure. This approach neglects the human element of healthcare, potentially leaving patients feeling like a case number rather than an individual. It fails to meet the standard of care that requires empathetic engagement and can lead to patient dissatisfaction and a lack of adherence to treatment plans. Adopting a purely transactional communication style, where the interaction is limited to the bare minimum of information exchange, is also professionally unacceptable. This can be perceived as dismissive or uncaring, eroding trust. It violates the principle of beneficence, as it does not actively contribute to the patient's emotional well-being or their confidence in the telehealth service. Relying solely on pre-scripted responses or generic greetings without adapting to the individual patient's needs and emotional state demonstrates a lack of personalized care. This can make the interaction feel impersonal and insincere, undermining the development of trust. It fails to acknowledge the unique circumstances and feelings of each patient, which is a cornerstone of ethical healthcare practice. Professional reasoning. When faced with building trust and rapport remotely, a CTC should first assess the patient's comfort level with technology and the telehealth format. This involves initiating the conversation with a warm greeting and a brief check-in about their experience. The professional should then prioritize active listening, using verbal and nonverbal cues, where visible, to demonstrate engagement. Empathy should be woven into the conversation by acknowledging the patient's feelings and concerns. Clear, simple language should be used, and opportunities for the patient to ask questions should be consistently provided. Finally, the CTC should summarize key points and next steps, ensuring the patient feels informed and supported. This systematic approach ensures that both the clinical and relational aspects of care are addressed, fostering a strong and trusting patient-provider relationship in the telehealth environment. Question 2. The audit findings indicate a potential unauthorized access to a mobile device containing patient health information. The device was left unattended in a public area. The Certified Telehealth Coordinator, CTC, receives an alert from the organization's security system flagging unusual activity on this device. What is the most appropriate immediate course of action for the CTC to take to ensure HIPAA compliance and protect patient privacy? Option A. Discuss the alert and the potential breach with other team members to gather their opinions on how to proceed. Option B. Delete all patient data from the device remotely to prevent any potential access without further investigation. Option C. Assume the alert is a false positive and continue with regular duties, as the device is encrypted. Option D. Immediately secure the device, notify the IT security department and the compliance officer, and await further instructions for a risk assessment. The correct answer is D. Immediately secure the device, notify the IT security department and the compliance officer, and await further instructions for a risk assessment. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for patient care with the stringent requirements of HIPAA, specifically concerning protected health information. 5. The coordinator must act decisively to address the potential breach, while ensuring all actions are compliant and protect patient privacy. Careful judgment is required to avoid further violations or compromising patient safety. The correct approach represents best professional practice because it prioritizes immediate containment and investigation of the potential breach in a manner that is both HIPAA compliant and ethically sound. This involves securing the device, notifying the appropriate parties, IT security, compliance officer, and initiating a risk assessment to determine the scope and impact of the potential breach. This proactive and systematic response aligns with HIPAA breach notification rule and the organization's internal policies for incident response, ensuring that patient privacy is protected and that the organization can take appropriate remedial actions. An incorrect approach that involves immediately deleting the data without proper documentation or investigation is a regulatory and ethical failure. This action could be construed as an attempt to conceal a breach, which is a serious violation of HIPAA. It prevents a proper risk assessment, hinders the organization's ability to notify affected individuals if required, and undermines the integrity of the incident response process. Furthermore, it fails to address the root cause of the potential breach. Another incorrect approach, such as ignoring the alert due to a perceived low risk or assuming it's a false positive without investigation, represents a significant regulatory and ethical failure. This inaction demonstrates a disregard for patient privacy and HIPAA mandate to protect PHI. It leaves the organization vulnerable to further breaches and potential penalties. It also fails to uphold the professional responsibility to safeguard sensitive information. A third incorrect approach, which involves discussing the potential breach with colleagues not directly involved in the incident response or patient care without a need-to-know basis, is a violation of HIPAA minimum necessary standard. This unauthorized disclosure of PHI, even in a discussion about a potential breach, can itself constitute a breach of privacy. It erodes patient trust and exposes the organization to liability. The professional decision-making process for similar situations should involve a clear incident response plan. This plan should outline steps for identifying, reporting, assessing, and mitigating potential breaches. Professionals should always prioritize patient privacy and data security, adhere strictly to HIPAA regulations and organizational policies, and seek guidance from their compliance officer or legal counsel when uncertain. Documentation of all actions taken is crucial for demonstrating compliance and for post-incident review. Question 3. The control framework reveals that a new set of federal regulations governing the privacy and security of patient health information transmitted via telehealth services has been enacted. As a certified telehealth coordinator, what is the most appropriate initial step to ensure ongoing compliance and minimize disruption to patient care? Option A. Rely on existing data security measures and patient consent forms, assuming they are sufficient until specific guidance on noncompliance is issued by regulatory bodies. Option B. Immediately cease all telehealth services until all staff can be retrained on the new regulations to avoid any potential violations. Option C. Update all telehealth software and hardware to the latest versions, assuming this will automatically bring the service into compliance with the new regulations. Option D. Conduct a comprehensive impact assessment to identify all affected telehealth services, data handling protocols, and patient consent procedures, and develop a phased implementation plan for necessary adjustments. The correct answer is D. Conduct a comprehensive impact assessment to identify all affected telehealth services, data handling protocols, and patient consent procedures, and develop a phased implementation plan for necessary adjustments. Explanation: this scenario is professionally challenging because it requires a certified telehealth coordinator, CTC, to balance the immediate need for patient access to care with the imperative to comply with evolving telehealth regulations and data privacy laws. The CTC must proactively assess the impact of these changes on existing telehealth service delivery models and patient data handling procedures. The correct approach represents best professional practice because it prioritizes a systematic and comprehensive impact assessment. This involves identifying all affected systems, processes, and stakeholders, and then evaluating the potential consequences of regulatory changes on patient privacy, data security, service accessibility, and operational workflows. This proactive stance ensures that the organization can adapt its telehealth services in a compliant and ethical manner, minimizing risks and maintaining patient trust. This aligns with the fundamental principles of patient-centered care and regulatory adherence expected of a CTC. An incorrect approach that focuses solely on immediate service continuation without a thorough impact assessment risks significant regulatory noncompliance. For instance, continuing to use outdated data transmission methods or failing to update patient consent forms to reflect new privacy requirements could lead to breaches of patient confidentiality, violating regulations such as HIPAA, if U.S. jurisdiction is implied for CTC exam, or equivalent data protection laws. Another incorrect approach, such as halting all telehealth services until absolute certainty is achieved, would be detrimental to patient care and could be seen as failing in the duty to provide accessible healthcare, potentially contravening accessibility mandates. Prioritizing technology upgrades over understanding the regulatory implications of those upgrades would also be a failure, as technology must serve compliance and patient safety, not the other way around. Professionals should employ a decision-making framework that begins with understanding the scope and implications of new or revised regulations. This involves consulting official regulatory guidance, seeking legal counsel when necessary, and engaging relevant internal departments e.g., IT, legal, compliance, clinical operations. A risk-based approach should then be applied to prioritize mitigation strategies, ensuring that patient safety and data privacy remain paramount while maintaining service continuity where possible. Regular training and updates for staff are also crucial components of this framework. Question 4. The assessment process reveals that a new telehealth program is being designed with a strong emphasis on cutting-edge technology and immediate patient access. However, there is a perceived lack of understanding regarding the foundational principles and early challenges that shape the current telehealth landscape. Which historical perspective is most critical for the Certified Telehealth Coordinator, CTC, to integrate into the program's design to ensure long-term sustainability and compliance? Option A. The rapid technological advancements in the last decade, focusing on the development of high-definition video conferencing and artificial intelligence-driven diagnostic tools. Option B. The financial incentives and reimbursement policies that have been introduced in recent years to encourage widespread telehealth adoption. Option C. The evolution of telehealth from its early experimental phases, driven by a need to extend healthcare to underserved rural populations, and the initial regulatory frameworks that emerged to govern these nascent services. Option D. The impact of major public health crises on the immediate expansion of telehealth services, highlighting the reactive nature of policy changes. The correct answer is C. The evolution of telehealth from its early experimental phases, driven by a need to extend healthcare to underserved rural populations, and the initial regulatory frameworks that emerged to govern these nascent services. Explanation: the assessment process reveals a common challenge in telehealth. Understanding the historical context of its development is crucial for effective implementation and risk management. Without this understanding, coordinator might overlook foundational principles or fail to anticipate evolving regulatory landscapes. The correct approach recognizes that early telehealth initiatives, often driven by technological innovation and a desire to expand access, laid the groundwork for current practices. Understanding these historical drivers helps in appreciating the rationale behind certain regulations and ethical considerations that have emerged over time. For instance, Early concerns about patient privacy and data security, though addressed with more sophisticated technologies today, originated from these foundational efforts. This historical perspective informs a proactive approach to compliance and patient care, aligning with the Certified Telehealth Coordinator (CTC) role's emphasis on robust telehealth service delivery. An incorrect approach might focus solely on current technologies without considering their historical evolution. This could lead to a superficial understanding of why certain protocols are in place, potentially resulting in misinterpretations of regulatory intent or an inability to adapt to future changes. For example, ignoring the early struggles with reimbursement models for telehealth could lead to a failure to advocate for appropriate service coverage, impacting both patient access and provider sustainability. Another incorrect approach might dismiss early telehealth efforts as primitive and irrelevant, overlooking the ethical frameworks and patient-centric considerations that were being established even with less advanced technology. This could result in a disregard for the long-standing importance of informed consent and the patient-provider relationship in remote care settings. Professionals should approach this by first identifying the core drivers behind telehealth's inception and growth. This involves researching seminal projects, key technological advancements, and the initial regulatory responses. Understanding these historical milestones allows for a more nuanced interpretation of current regulations and ethical guidelines, fostering a proactive and adaptable approach to telehealth coordination. It encourages a continuous learning mindset, recognizing that telehealth is a dynamic field shaped by its past. Question 5. Assessment of which of the following best aligns with the definition and scope of telehealth as understood within the regulatory framework for certified telehealth coordinators. Option A. Mailing a patient a paper copy of their lab results after a physical examination. Option B. A patient calling the clinic's main phone line to schedule a routine appointment. Option C. Providing a patient with a prescription refill via a secure online patient portal, where the physician reviews the request and electronically sends the prescription to the pharmacy. Option D. A healthcare provider conducting an in-person follow-up appointment at the patient's home to review their condition. The correct answer is C. Providing a patient with a prescription refill via a secure online patient portal, where the physician reviews the request and electronically sends the prescription to the pharmacy. Explanation. This scenario presents a professional challenge because it requires a nuanced understanding of the definition and scope of telehealth within the specific regulatory framework governing the Certified Telehealth Coordinator (CTC) exam. The core difficulty lies in distinguishing between services that definitively fall under the telehealth umbrella and those that might be considered related but not strictly telehealth, or those that are outside the scope entirely. Careful judgment is required to ensure compliance with regulations, maintain patient safety, and uphold ethical standards. The correct approach represents best professional practice because it accurately applies the established definition of telehealth as the provision of healthcare services using electronic information and telecommunications technologies. This includes remote clinical services, patient and professional education, public health, and health administration. It encompasses a broad range of activities that facilitate the delivery of care at a distance, aligning with the regulatory intent to expand access and improve efficiency. Adhering to this definition ensures that the coordinator is identifying and managing services that are indeed within the purview of telehealth, thereby promoting compliant and effective telehealth operations. An incorrect approach that includes services not utilizing electronic information and telecommunications technologies for healthcare delivery fails to adhere to the fundamental definition of telehealth. This could lead to misclassification of services, potentially resulting in non-compliance with telehealth-specific regulations, improper billing, or a misunderstanding of the coordinator's responsibilities. For instance, including purely administrative tasks that do not involve remote communication or data transmission would be a regulatory failure. Another incorrect approach that narrowly defines telehealth to exclude services like remote patient monitoring or store-and-forward technologies would be an ethical and regulatory failure. These are well-established modalities within the scope of telehealth, and their exclusion would limit the effective application of telehealth services, potentially hindering patient care and access, and failing to meet the comprehensive definition provided by regulatory bodies. The professional decision-making process for similar situations should involve a systematic review of the service in question against the official definition and scope of telehealth as outlined by the relevant regulatory framework. This includes identifying the core components of the service. Is it a healthcare service? Does it involve electronic information and telecommunications technologies? Is it being provided remotely? If the service meets these criteria, it falls within the scope of telehealth. If not, it should be classified accordingly. Professionals should consult official guidelines and seek clarification from regulatory bodies, when in doubt, to ensure accurate interpretation and application of telehealth definitions. Question 6. Comparative studies suggest that optimizing the intake process for new patients seeking telemental health services can significantly improve patient engagement and reduce administrative burden. Considering the strict regulatory framework for telehealth in the U.S., which of the following approaches best balances efficiency with the absolute priority of patient privacy and data security for sensitive mental health information? Option A. Relying on a single, strong password requirement for patient portal access, assuming patients will follow best practices for password management. Option B. Transmitting all patient intake forms and session recordings via standard, unencrypted email to expedite the process. Option C. Implementing a multi-factor authentication system for all patient portal access, including initial intake forms and subsequent session scheduling, coupled with end-to-end encryption for all data transmission and storage of patient records. Option D. Utilizing a cloud-based storage solution for patient records that offers basic password protection, but does not include specific encryption protocols for sensitive mental health data. The correct answer is C. Implementing a multi-factor authentication system for all patient portal access, including initial intake forms and subsequent session scheduling, coupled with end-to-end encryption for all data transmission and storage of patient records. Explanation. This scenario presents a common challenge in specialty telehealth, specifically mental health, where the sensitive nature of patient information and the therapeutic relationship require meticulous adherence to privacy regulations and ethical best practices. The professional challenge lies in balancing the efficiency of process optimization with the absolute necessity of maintaining patient confidentiality and ensuring the quality of care delivered remotely. The Certified Telehealth Coordinator, CTC, must navigate these complexities while operating strictly within the specified regulatory framework. The correct approach represents best professional practice because it prioritizes patient privacy and data security, which are paramount under telehealth regulations. By implementing robust, multi-factor authentication and encryption protocols specifically designed for sensitive mental health data, the CTC ensures compliance with privacy laws, such as HIPAA in the U.S. context, which mandates stringent safeguards for protected health information. 5. This proactive stance minimizes the risk of data breaches and maintains patient trust, fostering a secure environment for remote therapeutic interventions. An incorrect approach that fails to implement multi-factor authentication for patient access to mental health portals is professionally unacceptable. This directly violates privacy regulations by creating a vulnerability that could lead to unauthorized access to PHI. Such a failure could result in significant legal penalties, reputational damage, and erosion of patient confidence. Another incorrect approach that relies solely on a single password for patient access to mental health records is also professionally unacceptable. This is a weak security measure that is easily compromised, again leading to potential privacy violations and non-compliance with data protection laws. The lack of additional verification steps leaves patient data exposed. A third incorrect approach that involves transmitting mental health session recordings via unencrypted email is a severe regulatory and ethical failure. Unencrypted transmission of PHI is a direct contravention of privacy laws and ethical guidelines for healthcare professionals. This practice exposes sensitive patient information to interception and unauthorized disclosure, posing a grave risk to patient privacy and well-being. The professional decision-making process for similar situations should involve a thorough risk assessment of all telehealth processes, particularly for specialty services handling sensitive data. This includes identifying potential vulnerabilities, understanding the specific regulatory requirements of the jurisdiction, and implementing technical and administrative safeguards that align with best practices for data security and patient privacy. Continuous training and awareness of evolving threats and regulatory updates are also crucial for maintaining compliance and ethical standards. Question 7. Quality control measures reveal a patient consultation where a healthcare provider and patient engaged in a live video call, allowing for immediate visual assessment and verbal exchange of medical information. The provider was able to ask questions and receive direct answers, and the patient could observe the provider's responses in real time. Based on the regulatory framework for telehealth services, how should this type of interaction be categorized? Option A, remote patient monitoring. Option B, asynchronous telehealth. Option C, store and forward telehealth. Option D, synchronous telehealth. The correct answer is D, synchronous telehealth. Explanation: this scenario presents a professional challenge because the Certified Telehealth Coordinator, CTC, must accurately categorize telehealth service types to ensure appropriate billing, compliance, and patient care protocols are followed. Misclassification can lead to significant regulatory penalties, financial discrepancies, and potentially suboptimal patient outcomes. The core of the challenge lies in understanding the distinct characteristics of synchronous, asynchronous, and remote patient monitoring, RPM, services, and applying these definitions to real-world clinical interactions. The correct approach is to identify the service as synchronous telehealth. This is because the interaction involves real-time audio and visual communication between the patient and the healthcare provider, allowing for immediate feedback and assessment. This aligns with the definition of synchronous telehealth, which is crucial for accurate service documentation and reimbursement under relevant telehealth regulations. Best professional practice dictates precise categorization to maintain compliance with payer policies and federal/state telehealth laws, which often have specific requirements for different service modalities. An incorrect approach would be to classify this as asynchronous telehealth. This is a regulatory and ethical failure because asynchronous telehealth relies on the transmission of patient data, e.g., images, messages, for later review by a provider, lacking the immediate interactive element of the described scenario. Another incorrect approach would be to label it solely as remote patient monitoring. While RPM may involve data collection, the described scenario explicitly details a live, interactive consultation, which is the defining characteristic of synchronous telehealth, not the primary function of RPM, which focuses on ongoing data collection and trend analysis outside of direct, real-time encounters. Failing to distinguish these modalities can lead to improper billing codes, non-compliance with program requirements, and potential patient dissatisfaction if expectations of real-time interaction are not met. The professional decision-making process for similar situations should involve a thorough review of the patient encounter's characteristics. The CTC must ask, was the interaction live and interactive? Did it involve real-time audio and or video? Was there immediate feedback and assessment? If the answer to these questions is yes, it points to synchronous telehealth. If the interaction involved delayed communication or data review, then asynchronous or RPM might be more appropriate, depending on the specific context of data collection and provider engagement. Adherence to established definitions and regulatory guidelines for each telehealth modality is paramount. Question 8. To address the challenge of ensuring private insurance reimbursement for a scheduled telehealth consultation, what is the most prudent and compliant course of action for a certified telehealth coordinator? Option A. Submit the claim to the insurance payer without prior verification, anticipating that most telehealth services are now routinely covered. Option B. Contact the patient's insurance payer directly to verify coverage for the specific telehealth service, including any applicable co-pays, deductibles, and reimbursement rates, and obtain pre-authorization if required. Option C. Bill the patient directly for the full cost of the telehealth service, advising them to seek reimbursement from their insurance company independently. Option D. Proceed with billing the insurance payer based on general knowledge of telehealth reimbursement policies for similar services, assuming coverage will be granted. The correct answer is B. Contact the patient's insurance payer directly to verify coverage for the specific telehealth service, including any applicable co-pays, deductibles, and reimbursement rates, and obtain pre-authorization if required. Explanation: this scenario is professionally challenging because private insurance telehealth reimbursement is a complex and evolving area, heavily dependent on specific payer policies, state and federal regulations, and the nature of the telehealth service provided. A certified telehealth coordinator, CTC, must navigate these intricacies to ensure appropriate billing and prevent financial loss for the provider or patient, while also maintaining compliance. The core challenge lies in the variability of reimbursement rules, which can differ significantly between insurance plans and even for the same plan based on the service code, patient location, and provider type. The correct approach represents best professional practice because it involves a proactive and systematic verification process. By directly contacting the payer and obtaining a pre-authorization or coverage confirmation, the CTC ensures that the specific telehealth service is covered, under what conditions, and at what reimbursement rate. This aligns with the principle of due diligence in healthcare administration and billing, minimizing the risk of claim denials and subsequent appeals. It also upholds ethical billing practices by ensuring transparency and accuracy in financial arrangements with both the patient and the payer. This approach prioritizes patient access to care by confirming financial feasibility upfront. An incorrect approach that relies solely on general knowledge of telehealth reimbursement would be professionally unacceptable. This is because general knowledge is insufficient to account for the specific nuances of individual insurance policies. The regulatory and ethical failure here is a lack of due diligence, potentially leading to inaccurate billing, claim denials, and financial repercussions. This could also result in the patient being unexpectedly responsible for the full cost of services, creating a breach of trust and potentially violating consumer protection principles related to transparent billing. Another incorrect approach that involves billing without confirming coverage would also be a significant regulatory and ethical failure. This demonstrates a disregard for established billing protocols and payer requirements. The failure lies in assuming coverage without verification, which is a direct violation of sound financial management and compliance practices. This can lead to significant administrative burdens in managing denied claims, potential penalties for noncompliance, and damage to the provider's reputation. It also places an undue financial burden on the patient if the claim is ultimately denied. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the specific telehealth service and the patient's insurance plan. 2. Consult the payer's provider manual or website for general telehealth reimbursement guidelines, but recognize these are often high-level. 3. Directly contact the insurance payer to verify coverage for the specific CPT/HCPCS code, place of service, and provider type. 4. Obtain a pre-authorization or coverage confirmation in writing or via a recorded call, noting the representative's name and reference number. 5. Document this verification thoroughly in the patient's record. 6. Proceed with billing based on the confirmed coverage details. Question 9. Benchmark analysis indicates that healthcare organizations are increasingly adopting video conferencing tools for remote patient care. As a certified telehealth coordinator, you are tasked with evaluating and selecting a new platform. Considering the paramount importance of patient privacy and data security under U.S. federal regulations, which of the following approaches best aligns with regulatory requirements and professional best practices? Option A. Prioritize a platform that has a readily available business associate agreement (BA) with your organization and offers robust security features such as end-to-end encryption and secure data storage, while also considering integration capabilities and accessibility. Option B. Select a platform that offers the most advanced features and a user-friendly interface, assuming that most modern communication tools are sufficiently secure for healthcare use. Option C. Opt for a free, widely used consumer-grade video conferencing application, as it is familiar to many patients and staff, and can be quickly deployed to meet immediate telehealth needs. Option D. Choose the most cost-effective solution available, as budget constraints are a primary concern for many healthcare providers, and then implement basic security measures as needed. The correct answer is B. Select a platform that offers the most advanced features and a user-friendly interface, assuming that most modern communication tools are sufficiently secure for healthcare use. Explanation. Scenario analysis. This scenario presents a common challenge in telehealth: selecting and implementing video conferencing tools that balance technological capability with stringent patient privacy and data security regulation. Certified Telehealth Coordinator, CTC, must navigate the complex landscape of federal and state laws, particularly the Health Insurance Portability and Accountability Act, HIPAA, in the U.S., to ensure patient confidentiality and data integrity. The professional challenge lies in identifying a solution that is not only functional and user-friendly, but also demonstrably compliant, avoiding potential breaches that could lead to severe legal penalties, reputational damage, and erosion of patient trust. The rapid evolution of technology further complicates this, requiring ongoing vigilance and adaptation. Correct approach analysis. The correct approach involves a thorough due diligence process that prioritizes compliance with HIPAA and relevant state privacy laws. This means selecting a video conferencing platform that has a business associate agreement (BA) in place with the healthcare provider. A BAA is a legally binding contract that ensures the vendor will appropriately safeguard protected health information. (FI). Furthermore, the platform must offer robust security features such as end-to-end encryption, secure data storage, access controls, and audit trails. The CTC must also consider the platform's ability to integrate with existing electronic health record (EHR) systems securely, and its adherence to accessibility standards to ensure equitable care. This comprehensive evaluation ensures that the chosen technology supports the delivery of telehealth services while upholding the highest standards of patient privacy and data security, aligning with the ethical obligations of a healthcare professional and the legal mandates of HIPAA. Incorrect approaches analysis. Choosing a platform solely based on its advanced features or cost-effectiveness without verifying its HIPAA compliance and BAA status is a significant regulatory and ethical failure. This approach disregards the fundamental requirement to protect PHI, exposing the organization to substantial risks of data breaches and violations of HIPAA privacy and security rules. Opting for a free or consumer-grade video conferencing tool, even if it appears user-friendly, is another critical failure. These platforms are typically not designed for healthcare settings and lack the necessary security protocols and BAAs to handle PHI. Their use constitutes a direct violation of HIPAA, as they do not offer adequate safeguards for sensitive patient information. Implementing a platform without adequate staff training on its secure use and privacy protocols is also a failure. Even a compliant platform can become a vulnerability if users do not understand how to operate it securely, leading to accidental disclosures or data mishandling. This neglects the operational aspects of maintaining a secure telehealth environment and can indirectly lead to regulatory noncompliance. Professional reasoning. Professionals in telehealth must adopt a risk-based decision-making framework. This involves 1. Identifying all applicable regulations, e.g., HIPAA state-specific privacy laws. 2. Assessing the potential risks associated with each technology option, particularly concerning data privacy and security. 3. Prioritizing compliance and security over features or cost when selecting tools that handle PHI. 4. Conducting thorough vendor due diligence, including reviewing BAAs and security certifications. 5. Implementing robust training and ongoing monitoring to ensure continued compliance and secure usage. This systematic approach ensures that technology choices support, rather than undermine, the ethical and legal obligations of providing telehealth services. Question 10. Compliance review shows that a primary care practice is experiencing challenges in effectively implementing its telehealth program, with a significant portion of its patient population, particularly older adults and those with limited English proficiency, struggling to access or utilize the virtual appointment system. The practice is seeking to address this implementation gap. Which of the following approaches best aligns with regulatory requirements and ethical best practices for telehealth in primary care? Option A. Focus telehealth efforts exclusively on younger, more tech-savvy patient demographics, while maintaining traditional in-person services for all other patient groups. Option B. Implement a policy requiring all patients to complete a mandatory digital literacy training module before being eligible for telehealth appointments. Option C. Develop a comprehensive patient outreach program that identifies individuals facing technological or literacy barriers and offers tailored support, including in-person assistance with setup, simplified user guides in multiple languages, and alternative communication channels for scheduling and technical troubleshooting. Option D. Limit telehealth services to patients who can independently navigate the online scheduling portal and virtual visit platform, assuming that those who cannot will continue to utilize traditional in-person appointments. The correct answer is C. Develop a comprehensive patient outreach program that identifies individuals facing technological or literacy barriers and offers tailored support, including in-person assistance with setup, simplified user guides in multiple languages, and alternative communication channels for scheduling and technical troubleshooting. Explanation. Scenario analysis. This scenario presents a common implementation challenge in telehealth for primary care, ensuring equitable access to technology and digital literacy among a diverse patient population. The professional challenge lies in balancing the efficiency and reach of telehealth with the ethical and regulatory obligation to serve all patients, including those who may face barriers to participation. A careful judgment is required to avoid creating a two-tiered system of care, where some patients are inadvertently excluded due to technological limitations. Correct approach analysis. The correct approach prioritizes patient-centered care and adherence to regulatory frameworks that mandate accessibility and non-discrimination. By proactively identifying patients with potential barriers and offering tailored support, the practice demonstrates a commitment to the principles of universal access and equitable care delivery. This aligns with the ethical imperative to serve all members of the community and the regulatory expectation that telehealth services should not disadvantage specific patient groups. Providing multiple avenues for engagement, such as in-person assistance, simplified interfaces, and alternative communication methods, ensures that the benefits of telehealth are extended to all eligible patients, thereby upholding the integrity of primary care services. Incorrect approaches analysis. One incorrect approach involves assuming all patients possess the necessary technological resources and digital skills. This overlooks the reality of digital divides and can lead to discriminatory practices, violating the ethical duty to provide care without prejudice, and potentially contravening regulations that prohibit discrimination based on socioeconomic status or ability. Another incorrect approach is to limit telehealth services to only those patients who can independently navigate the technology. This creates an exclusionary practice, failing to meet the needs of a significant portion of the patient population and undermining the goal of accessible primary care. Finally, an approach that relies solely on patient self-identification of technological barriers without active outreach and support is insufficient. It places an undue burden on patients who may already be struggling and fails to proactively address systemic access issues, thus not fulfilling the provider's responsibility to ensure equitable access. Professional reasoning. Professionals should adopt a proactive and inclusive approach to telehealth implementation. This involves conducting a thorough assessment of patient needs, identifying potential barriers to technology access and digital literacy, and developing targeted strategies to mitigate these barriers. Decision-making should be guided by a commitment to patient-centered care, ethical principles of equity and non-discrimination, and a comprehensive understanding of relevant telehealth regulations. When faced with implementation challenges, professionals should prioritize solutions that enhance accessibility and ensure that all patients can benefit from telehealth services, rather than opting for approaches that inadvertently exclude or disadvantage certain patient groups. Question 11. Strategic planning requires a certified telehealth coordinator, CTC, to ensure accurate billing for services rendered. Following a telehealth consultation, the CTC reviews the physician's encounter notes, which detail a moderate level of complexity in diagnosis and management. The physician suggests billing for a higher-level code to reflect the perceived effort and potential future care needs. The CTC has access to the detailed documentation of the telehealth visit, including the duration, nature of the patient-provider interaction, and the physician's assessment and plan. What is the most appropriate course of action for the CTC? Option A. Select the CPT code that most accurately and specifically reflects the services documented in the physician's encounter notes, even if it is a lower reimbursement code than suggested. Option B. Bill for a slightly more complex service than what is explicitly documented to account for the physician's perceived effort and potential future care needs. Option C. Delay billing until further clarification can be obtained from the physician, even if it means missing a billing deadline. Option D. Bill using the higher-level code suggested by the physician, assuming their clinical judgment about the complexity of the encounter justifies it. The correct answer is A. Select the CPT code that most accurately and specifically reflects the services documented in the physician's encounter notes, even if it is a lower reimbursement code than suggested. Explanation. This scenario presents a professional challenge due to the inherent tension between maximizing reimbursement and adhering strictly to documentation and billing code requirements. The Certified Telehealth Coordinator, CTC, must navigate this ethical tightrope, ensuring that all services rendered are accurately represented and appropriately coded, without resorting to practices that could be construed as fraudulent or misleading. The core of the challenge lies in the potential for misinterpretation of service delivery and the temptation to round up or select codes that might offer higher reimbursement but don't precisely reflect the documented service. Careful judgment is required to balance the financial health of the practice with the integrity of billing practices and patient care. The correct approach represents best professional practice because it prioritizes accurate documentation and coding, which are foundational to ethical and compliant billing. By meticulously reviewing the patient encounter notes and selecting the CPT code that precisely matches the documented service, the CTC upholds the principles of transparency and honesty in healthcare billing. This aligns with the regulatory framework that mandates accurate reporting of services rendered for reimbursement. Furthermore, it demonstrates a commitment to patient care by ensuring that billing reflects the actual level of service provided, preventing potential overcharging or misrepresentation of care. An incorrect approach that involves selecting a higher-level billing code than what is strictly supported by the documentation is a direct violation of regulatory requirements. This constitutes billing fraud or abuse, as it misrepresents the services provided to the payer. Such an action erodes trust in the healthcare system and can lead to severe penalties for the provider, including fines, recoupment of payments, and exclusion from federal healthcare programs. Another incorrect approach, which is to bill for services that were not fully rendered or documented, is also a form of fraud and a breach of ethical conduct. This not only violates regulations, but also undermines the professional integrity of the CTC and the organization. The professional decision-making process for similar situations should involve a systematic review of patient encounter documentation against established billing code guidelines. When in doubt, seeking clarification from supervisors or consulting official coding resources is paramount. The CTC should always err on the side of caution and accuracy, understanding that compliance and ethical integrity are non-negotiable aspects of their role. This involves a proactive approach to staying updated on coding changes and regulatory updates, and fostering a culture of compliance within the telehealth practice. Question 12. Consider a scenario where a patient presents with symptoms suggestive of a mild upper respiratory infection. The patient is a busy professional who lives in a rural area with limited access to local healthcare providers and has expressed a preference for convenience. The Certified Telehealth Coordinator, CTC, must advise on the most appropriate method of healthcare delivery. Option A. Recommend a telehealth consultation, ensuring the patient understands the limitations of remote diagnosis and providing clear instructions for follow-up if symptoms worsen or do not improve. Option B. Suggest a telehealth consultation solely based on the patient's preference for convenience and the potential for cost savings for the healthcare system. Option C. Insist on an in-person visit to the nearest clinic, regardless of the patient's symptoms or location, to ensure a complete physical examination. Option D. Advise the patient to wait and see if their symptoms resolve on their own, without any medical consultation, due to the mild nature of the reported symptoms. The correct answer is A. Recommend a telehealth consultation, ensuring the patient understands the limitations of remote diagnosis and providing clear instructions for follow-up if symptoms worsen or do not improve. Explanation. This scenario presents a common challenge in telehealth, balancing the convenience and accessibility of remote care with the established standards and patient safety considerations of traditional in-person healthcare. The professional challenge lies in ensuring that the chosen delivery method, whether telehealth or traditional, aligns with patient needs, clinical appropriateness, and regulatory compliance without compromising the quality of care. Careful judgment is required to determine when telehealth is a suitable and effective alternative versus when a physical examination or in-person intervention is indispensable. The correct approach prioritizes patient well-being and adherence to the regulatory framework governing telehealth services within the specified jurisdiction. This involves a thorough assessment of the patient's condition, the nature of the service required, and the capabilities of telehealth technology to accurately diagnose, treat, or manage the condition. Best professional practice dictates that telehealth should be utilized when it can achieve comparable or superior outcomes to traditional care, while also considering factors like patient comfort, access to technology, and the ability to establish a sufficient provider-patient relationship remotely. This aligns with the ethical imperative to provide competent and appropriate care, and regulatory guidelines that often mandate that telehealth services meet the same standards of care as in-person services, with specific provisions for patient consent, privacy, and security. An incorrect approach that solely focuses on cost reduction without considering clinical appropriateness would fail to meet the standard of care. This could lead to misdiagnosis, delayed treatment, or inadequate management of conditions, potentially violating patient safety regulations and ethical obligations. Another incorrect approach that dismisses telehealth entirely in favor of traditional methods, even when telehealth is clinically indicated and beneficial for the patient, e.g., for routine follow-ups or managing chronic conditions, overlooks the advancements in technology and the potential for improved access and efficiency, potentially contravening guidelines that encourage the appropriate use of telehealth. Furthermore, failing to obtain informed consent regarding the limitations and benefits of telehealth would be a significant regulatory and ethical breach, as patients must understand the nature of the care they are receiving. Professional decision-making in such situations should involve a systematic evaluation process. This includes assessing the patient's clinical presentation, the specific healthcare need, the suitability of telehealth for that need based on established clinical guidelines and technological capabilities, and the patient's preferences and ability to engage with telehealth. A critical step is to consult relevant jurisdictional regulations and professional body guidelines to ensure compliance. If there is any doubt about the appropriateness or safety of telehealth for a particular situation, the default should be to recommend or provide traditional in-person care, or a hybrid approach that incorporates both. Question 13. The investigation demonstrates that a telehealth provider, when initiating a new telehealth service involving remote patient monitoring, provided patients with a link to a lengthy written consent document and a brief pre-recorded video explaining the general benefits of telehealth. The provider then proceeded with the telehealth appointment after the patient acknowledged receiving the information. Which of the following approaches best ensures that informed consent for this telehealth service is obtained in compliance with regulatory and ethical standards? Option A. Providing a written consent form that includes a clause stating that by participating in the telehealth appointment, the patient implicitly consents to all aspects of the service, including remote patient monitoring. Option B. Engaging in a direct, interactive discussion with the patient about the specific risks and benefits of remote patient monitoring, using plain language, offering the written document for review, and confirming the patient's understanding through targeted questions before proceeding. Option C. Relying solely on the pre-recorded video and the written consent document, assuming that patients will understand the implications of remote patient monitoring if they choose to proceed with the appointment. Option D. Sending the patient a detailed technical manual for the remote monitoring equipment and instructing them to read it thoroughly before the appointment. The correct answer is B. Engaging in a direct, interactive discussion with the patient about the specific risks and benefits of remote patient monitoring, using plain language, offering the written document for review, and confirming the patient's understanding through targeted questions before proceeding. Explanation. The investigation demonstrates a common challenge in telehealth, ensuring that informed consent is truly informed and understood by the patient, especially when technology introduces potential barriers. The professional challenge lies in balancing the convenience and accessibility of telehealth with the fundamental right of a patient to understand the nature, risks, benefits, and alternatives of their care, including the specific modalities used in remote delivery. Careful judgment is required to adapt traditional informed consent principles to the telehealth environment, ensuring no critical information is lost or misunderstood due to the virtual medium. The correct approach represents best professional practice because it actively addresses the unique aspects of telehealth. By providing consent information in multiple formats, written, verbal, and visual aids, and confirming patient comprehension through interactive questioning, the telehealth coordinator ensures that the patient is not merely acknowledging receipt of information, but genuinely understands it. This aligns with the ethical imperative to respect patient autonomy and the regulatory requirement to obtain valid consent, which necessitates clear and understandable communication. The use of plain language and opportunities for questions further reinforces this commitment to patient understanding. An incorrect approach that relies solely on a pre-recorded video for consent information fails to ensure comprehension. This is a regulatory and ethical failure because it presumes understanding without verification. Patients may not fully grasp the implications of telehealth, such as data security, the limitations of remote examination, or the process for emergency escalation, if they are passively receiving information. Another incorrect approach that only offers a written document without further explanation or opportunity for questions is also deficient. This fails to account for varying literacy levels or language barriers and neglects the interactive nature of effective informed consent, potentially leading to a consent that is technically obtained but not truly informed. A third incorrect approach that assumes consent is implied by the patient's willingness to proceed with the telehealth appointment is a significant regulatory and ethical breach. This bypasses the explicit requirement for consent and disrespects patient autonomy, creating a situation where care is provided without proper authorization. Professionals should employ a decision-making framework that prioritizes patient understanding and autonomy. This involves 1. Identifying the specific telehealth service and its associated risks and benefits. 2. Tailoring the consent process to the individual patient's needs, considering their technological literacy, language, and any potential cognitive impairments. 3. Employing a multimodal approach to information delivery, including written materials, verbal explanations, and visual aids. 4. Actively verifying patient comprehension through open-ended questions and allowing ample opportunity for discussion and clarification. 5. Documenting the informed consent process thoroughly, including the methods used to ensure understanding. Question 14. Upon reviewing a patient's telehealth appointment scheduled with a provider licensed in State A, but the patient is physically located in State B, which of the following actions best ensures compliance with state and federal telehealth regulations? Option A. Relying on the telehealth platform's internal compliance checklist, which generally covers common telehealth practices. Option B. Proceeding with the appointment as scheduled, assuming that if the provider is licensed in their home state, it is sufficient for interstate telehealth. Option C. Confirming that the provider is licensed in state and that the telehealth platform adheres to HIPAA, as federal regulations are paramount. Option D. Verifying that the provider holds a license in State B, the patient's current location, and that all telehealth services provided comply with State B's specific telehealth statutes. The correct answer is C. Confirming that the provider is licensed in state and that the telehealth platform adheres to HIPAA, as federal regulations are paramount. Explanation. This scenario presents a common challenge for telehealth coordinators, navigating the complex and often overlapping state and federal regulations governing telehealth services. The core difficulty lies in ensuring compliance across multiple jurisdictions, especially when a patient receives care from a provider located in a different state. The Certified Telehealth Coordinator, CTC, must possess a thorough understanding of these regulations to avoid legal repercussions, protect patient privacy, and maintain the integrity of telehealth services. The correct approach prioritizes a comprehensive understanding of both federal and the specific state regulations applicable to the patient's location and the provider's location. This ensures that all legal requirements, including licensing, prescribing, and privacy, e.g., HIPAA, are met. Best professional practice dictates a proactive and informed stance, where the CTC actively seeks out and applies the most current regulatory guidance from relevant authorities. This minimizes risk and upholds the ethical obligation to provide safe and compliant care. An incorrect approach would be to assume that federal regulations alone are sufficient. While federal laws like HIPAA provide a baseline for privacy and security, they do not supersede state-specific telehealth laws regarding provider licensure, scope of practice, or prescribing authority. Another incorrect approach is to rely solely on the provider's state of licensure without considering the patient's location, which is critical for determining which state's laws apply to the patient's care. Finally, ignoring or misinterpreting specific state telehealth statutes, such as those governing originating sites or patient consent, can lead to significant legal and ethical violations, including practicing without a license or violating patient privacy. Professional decision-making in such situations requires a systematic process. First, identify the relevant jurisdictions, patient's location and provider's location. Second, research the federal telehealth regulations that apply universally. Third, thoroughly investigate the specific telehealth laws and regulations of both the patient's and provider states. Fourth, consult with legal counsel or regulatory experts if there is any ambiguity. Finally, document all compliance efforts and decisions. Question 15. The evaluation methodology shows that a patient requires a follow-up consultation for a chronic condition management plan, which is being delivered via a synchronous audio-visual telehealth encounter. The telehealth coordinator is aware that the payer's policy on reimbursement for this specific type of chronic condition management via telehealth is not explicitly detailed, leading to uncertainty about the appropriate billing code and coverage. The coordinator must decide how to proceed with submitting the claim to ensure proper reimbursement while adhering to all applicable regulations. Option A. Delay submitting the claim until the payer officially publishes a detailed policy update regarding chronic condition management via telehealth to ensure complete compliance. Option B. Submit the claim using a broader, less specific diagnosis code that is more commonly covered for telehealth services, hoping it will expedite approval and avoid potential denial due to policy ambiguity. Option C. Bill the service at the highest possible reimbursement rate for telehealth consultations, assuming that the service is covered and that the payer will approve it based on general telehealth coverage guidelines. Option D. Submit the claim using the most specific diagnosis code that accurately reflects the patient's condition and the clinical necessity for the telehealth service, and include detailed clinical notes justifying the use of telehealth, while also initiating a formal inquiry with the payer for clarification on their policy for this specific service. The correct answer is D. Submit the claim using the most specific diagnosis code that accurately reflects the patient's condition and the clinical necessity for the telehealth service, and include detailed clinical notes justifying the use of telehealth, while also initiating a formal inquiry with the payer for clarification on their policy for this specific service. Explanation. The evaluation methodology shows that reimbursement policies for telehealth services are complex and often subject to interpretation by payers. This scenario presents a professional challenge because a telehealth coordinator must navigate these ambiguities while ensuring both patient access to care and adherence to regulatory guidelines. The coordinator must balance the immediate need of the patient with the long-term financial viability and compliance of the telehealth program. Careful judgment is required to avoid potential fraud, waste, and abuse allegations, as well as to maintain positive relationships with both patients and payers. The correct approach represents best professional practice because it prioritizes accurate documentation and transparent communication with the payer. By thoroughly documenting the clinical necessity and the specific telehealth modality used, the coordinator ensures that the claim aligns with established payer policies and medical necessity requirements. Seeking clarification from the payer directly when policies are unclear is a proactive measure that mitigates risk and promotes accurate reimbursement. This aligns with ethical principles of honesty and integrity in billing and coding, and regulatory requirements for accurate claim submission. An incorrect approach that involves submitting the claim with a less specific diagnosis code to increase the likelihood of approval is professionally unacceptable. This constitutes misrepresentation of the patient's condition and can lead to allegations of fraud, waste, and abuse. It violates the ethical obligation to be truthful in all professional dealings and directly contravenes regulations requiring accurate and honest billing practices. Another incorrect approach, which is to delay submitting the claim until a definitive policy is published, is also professionally problematic. Caution is understandable. Prolonged delays can negatively impact patient access to care and the financial health of the telehealth program. It fails to proactively seek resolution and can be seen as an abdication of responsibility to manage the revenue cycle effectively. This approach does not demonstrate due diligence in pursuing appropriate reimbursement. A third incorrect approach, which is to assume the service is covered and bill at the highest possible reimbursement rate without verification, is highly risky and unprofessional. This demonstrates a lack of due diligence and a disregard for payer policies. It significantly increases the risk of claim denials, audits, and potential penalties for overpayment. This approach violates the fundamental principle of accurate billing and can lead to severe regulatory and financial repercussions. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understand the patient's clinical needs and the services provided. Second, consult all available payer policies and guidelines related to telehealth reimbursement for the specific service and patient population. Third, if ambiguity exists, proactively seek clarification from the payer through official channels. Fourth, ensure all documentation accurately reflects the clinical necessity and the telehealth modality used. Finally, submit claims accurately and transparently, prepared to provide further justification if requested. Question 16. Examination of the data shows a patient experiencing sudden, severe chest pain and shortness of breath while connected to a telehealth consultation with a certified telehealth coordinator, CTC. The patient is alone at home and unable to immediately access transportation. The CTC can see the patient's facial pallor and hear their labored breathing. What is the most appropriate immediate course of action for the certified telehealth coordinator? Option A. Suggest the patient take an over-the-counter pain reliever and rest, then follow up with their primary care physician in 24 hours. Option B. Ask the patient to describe their pain in more detail and try to ascertain if it is cardiac-related through further questioning. Option C. Attempt to guide the patient through a series of breathing exercises to alleviate their symptoms. Option D. Advise the patient to call local emergency medical services immediately and provide them with the patient's reported symptoms and location. The correct answer is D. Advise the patient to call local emergency medical services immediately and provide them with the patient's reported symptoms and location. Explanation. This scenario presents a significant ethical and professional challenge for a certified telehealth coordinator, CTC, operating within the U.S. regulatory framework. The core dilemma lies in balancing the immediate need for emergency care with the limitations of telehealth technology and the established protocols for patient safety and consent. The CTC must navigate the complexities of patient identification, the ability to provide a definitive diagnosis and treatment plan remotely, and the potential for misdiagnosis or delayed care when a physical examination is impossible. The urgency of the situation, coupled with the potential for severe patient harm, heightens the stakes. The correct approach prioritizes patient safety and adherence to established medical protocols for emergency care. It recognizes that while telehealth can be a valuable tool, it has limitations, particularly in acute situations where a physical assessment is critical. By immediately escalating the situation to a local emergency medical service (EMS) and providing the patient with clear instructions for immediate in-person care, the CTC ensures that the patient receives the most appropriate and timely intervention. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also adheres to the implicit understanding of the scope of practice for telehealth, which generally requires a clear pathway for escalation when the remote modality is insufficient. The CTC's role is to facilitate care, not to replace essential in-person emergency services when they are clearly indicated. An incorrect approach would be to attempt to manage the emergency solely through telehealth, perhaps by providing advice or prescribing medication without a physical examination. This would be a failure to adhere to the standard of care for emergency situations, potentially leading to misdiagnosis, delayed treatment, and severe patient harm. This could violate regulations concerning the appropriate use of telehealth and the physician's duty of care. Another incorrect approach would be to dismiss the patient's concerns without proper assessment or escalation, which would be a clear ethical failure and a violation of the CTC's responsibility to facilitate appropriate care. This demonstrates a lack of diligence and a disregard for patient well-being. A third incorrect approach might involve attempting to gather more information remotely that is not clinically feasible or safe to obtain, thereby delaying the necessary in-person intervention and potentially exacerbating the patient's condition. This shows a misunderstanding of the limitations of telehealth in critical care. Professional decision-making in such situations requires a rapid assessment of the patient's condition, a clear understanding of the capabilities and limitations of the telehealth platform, and a firm grasp of emergency medical protocols. The CTC must prioritize patient safety above all else, recognizing when remote assessment is insufficient and immediate in-person intervention is necessary. This involves a systematic approach. Assess the reported symptom, determine the acuity of the situation, consider the available diagnostic tools via telehealth. And if there is any doubt or clear indication of a medical emergency, initiate the appropriate escalation pathway to ensure the patient receives the highest level of care. Question 17. Performance analysis shows a certified telehealth coordinator, CTC, is monitoring a patient remotely. The patient reports feeling increasingly short of breath and experiencing chest tightness. A single, recent vital sign reading from the patient's home monitoring device indicates their oxygen saturation is 90%. What is the most appropriate immediate course of action for the CTC? Option A. Instruct the patient to immediately call emergency medical services, 911, due to the reported symptoms and low oxygen saturation. Option B. Dismiss the patient's reported symptoms as subjective and focus solely on the possibility of a device error with the oxygen saturation reading. Option C. Immediately contact the supervising clinician to report the patient's subjective symptoms and vital sign reading, and discuss the next steps for patient management. Option D. Advise the patient to take deep breaths, rest, and monitor their symptoms, as the single oxygen saturation reading might be inaccurate. The correct answer is C. Immediately contact the supervising clinician to report the patient's subjective symptoms and vital sign reading, and discuss the next steps for patient management. Explanation. Scenario analysis. This scenario presents a common challenge in telehealth where a patient's condition appears to be worsening, but the available data is limited to subjective patient reports and a single vital sign reading. The professional challenge lies in balancing the need for timely intervention with the limitations of remote assessment, ensuring patient safety without causing unnecessary alarm or resource utilization. The Certified Telehealth Coordinator, CTC, must navigate this ambiguity by adhering to established protocols and clinical judgment, prioritizing patient well-being within the regulatory framework. Correct approach analysis. The correct approach involves a structured escalation process that prioritizes patient safety and adheres to established clinical protocols for telehealth. This includes immediate follow-up with the patient to gather more detailed subjective information, such as the onset, duration, and severity of symptoms, and to assess for any new or concerning signs. Simultaneously, contacting the supervising clinician to report the findings and discuss next steps is crucial. This approach aligns with the ethical imperative to provide competent care and the regulatory requirement to ensure that telehealth services are delivered in a manner that is safe and effective, as outlined by relevant U.S. telehealth regulations and professional guidelines for healthcare providers. It ensures that a qualified clinician makes the ultimate decision regarding further diagnostic or therapeutic interventions. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's concerns due to the single abnormal vital sign, assuming it might be an anomaly. This fails to meet the standard of care by neglecting potentially serious symptoms and violates the ethical principle of beneficence, which mandates acting in the patient's best interest. It also contravenes U.S. telehealth regulations that require appropriate assessment and monitoring of patients receiving remote care. Another incorrect approach is to immediately dispatch emergency medical services without further assessment or consultation with the supervising clinician. While prioritizing safety, this action may be premature and could lead to unnecessary patient distress, increased healthcare costs, and inefficient use of emergency resources. This bypasses the established decision-making hierarchy and clinical judgment expected of a CTC, potentially violating protocols for patient triage and escalation. A third incorrect approach is to advise the patient to simply rest and monitor their symptoms without any further clinical follow-up or consultation. This is a direct abdication of responsibility, failing to adequately assess the patient's condition and potentially delaying critical care. It represents a significant ethical failure and a violation of regulatory requirements for providing safe and effective telehealth services. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the reported symptoms and available data. This involves active listening, detailed questioning, and understanding the limitations of remote assessment. The next step is to consult established clinical protocols and guidelines for telehealth, which typically outline escalation pathways for deteriorating patient conditions. Collaboration with the supervising clinician is paramount, ensuring that decisions are made with the benefit of their expertise. This systematic approach, grounded in patient safety ethical principles, and regulatory compliance, allows for effective management of ambiguous telehealth situations. Question 18. Research into the effectiveness of remote patient monitoring for individuals with type 2 diabetes has highlighted varying patient engagement levels. As a certified telehealth coordinator, CTC, which of the following approaches best aligns with regulatory requirements and ethical best practices for managing this chronic condition via telehealth? Option A. Utilizing a telehealth platform that collects extensive patient data, but does not explicitly inform patients about how this data will be used, stored, or protected, assuming implied consent through service utilization. Option B. Relying solely on the patient's self-reported adherence to medication and lifestyle changes during infrequent scheduled telehealth appointments, without utilizing any remote monitoring technology. Option C. Developing a comprehensive telehealth care plan that includes regular virtual check-ins with the patient, personalized education on diet and exercise, proactive monitoring of transmitted biometric data, and clearly defined escalation protocols for abnormal readings or patient-reported concerns. Option D. Implementing a system that automatically collects blood glucose readings and transmits them to the patient's electronic health record, with alerts triggered only for readings outside a predefined extreme range, without proactive patient check-ins or educational reinforcement. The correct answer is D. Implementing a system that automatically collects blood glucose readings and transmits them to the patient's electronic health record, with alerts triggered only for readings outside a predefined extreme range, without proactive patient check-ins or educational reinforcement. Explanation. This scenario is professionally challenging due to the inherent complexities of managing chronic diseases remotely, requiring a delicate balance between technological capabilities, patient safety, and regulatory compliance. The Certified Telehealth Coordinator, CTC, must navigate evolving patient needs, data privacy concerns, and the specific legal and ethical frameworks governing telehealth in their jurisdiction. Careful judgment is paramount to ensure that telehealth interventions enhance, rather than compromise, patient care and outcomes. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered strategy that aligns with regulatory mandates for telehealth service delivery. This involves a thorough assessment of the patient's condition, their technological literacy, and the availability of appropriate support systems. It also necessitates adherence to data security protocols and clear communication channels, as mandated by relevant telehealth regulations and ethical guidelines. This approach ensures that the telehealth intervention is not only clinically appropriate, but also legally sound and ethically responsible, fostering trust and optimizing patient engagement. An incorrect approach that relies solely on automated data collection without human oversight fails to meet the regulatory requirement for continuous patient monitoring and timely intervention. This oversight can lead to missed critical changes in a patient's condition, potentially violating duty of care obligations and specific telehealth practice standards that emphasize proactive management. Another incorrect approach that neglects to establish clear escalation protocols for critical patient data breaches regulatory requirements for incident reporting and patient notification, and ethically compromises patient privacy and security. Furthermore, an approach that fails to obtain informed consent for telehealth services, specifically detailing data usage and privacy measures, directly contravenes patient rights and legal mandates regarding consent in healthcare. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the patient's chronic condition and their individual circumstances. This should be followed by an evaluation of available telehealth technologies and their suitability for the patient's needs and the specific disease management goals. Crucially, this assessment must be conducted within the strict confines of the applicable regulatory framework, ensuring all proposed interventions comply with data privacy laws, licensing requirements, and practice standards. Regular review and adaptation of the telehealth plan based on patient progress and evolving regulatory guidance are essential components of this framework. Question 19. Analysis of a certified telehealth coordinator, CTC, receiving a patient request to quickly share sensitive test results via personal email due to perceived urgency and difficulty accessing the secure patient portal. The CTC is aware that personal email is not a HIPAA-compliant method for transmitting protected health information. 5. What is the most appropriate course of action for the CTC? Option A. Advise the patient to use a public Wi-Fi network to access the patient portal for faster results. Option B. Forward the results to the patient's personal email address, but encrypt the email with a password provided separately. Option C. Agree to send the results via personal email to expedite care, assuming the patient understands the risks. Option D. Politely decline the request to use personal email and guide the patient through accessing the secure patient portal, offering assistance if needed. The correct answer is D. Politely decline the request to use personal email and guide the patient through accessing the secure patient portal, offering assistance if needed. Explanation. Scenario analysis. This scenario presents a common yet complex ethical dilemma in telehealth, balancing patient convenience with stringent data security obligations. The challenge lies in the immediate need to provide care versus the potential for a data breach if less secure methods are employed. The Certified Telehealth Coordinator, CTC, must exercise sound professional judgment, prioritizing patient privacy and regulatory compliance above all else, even when faced with patient pressure or perceived urgency. Correct approach analysis. The correct approach prioritizes the use of secure, HIPAA-compliant communication channels for all patient interactions, including the sharing of sensitive health information. This aligns directly with the Health Insurance Portability and Accountability Act, HIPAA security rule, which mandates the implementation of appropriate administrative, physical, and technical safeguards to protect electronic protected health information (EFI). Utilizing a secure patient portal or encrypted email ensures that data is transmitted and stored in a manner that prevents unauthorized access, use, or disclosure, thereby upholding patient trust and avoiding significant legal and financial repercussions. Incorrect approaches analysis. Using personal email or text messaging for sharing patient test results is a direct violation of HIPAA. These methods are not inherently secure and lack the necessary encryption and access controls to protect ePHI, exposing the patient's sensitive information to potential interception and unauthorized access. This constitutes a breach of confidentiality and a failure to implement required technical safeguards. Suggesting the patient use a public Wi-Fi network for accessing their health portal without advising on security measures is also problematic. While the portal itself may be secure, public Wi-Fi is notoriously insecure, making the patient's device vulnerable to man-in-the-middle attacks or malware that could compromise their login credentials or other sensitive data. This indirectly exposes patient data and fails to ensure a secure end-to-end communication environment. Ignoring the patient's request and proceeding with a less secure method without explanation is unprofessional and erodes patient trust. While the intention might be to protect data, the lack of communication and education about why certain methods are necessary can lead to patient dissatisfaction and a perception of unresponsiveness, even if the underlying security principle is sound. It fails to educate the patient on best practices for their own data security in a telehealth context. Professional reasoning. When faced with such a situation, a CTC should first acknowledge the patient's request and explain the importance of data security in telehealth. They should then clearly outline the available secure communication methods, such as the patient portal or secure messaging system, and provide clear instructions on how to use them. If the patient expresses difficulty or urgency, the CTC should explore alternative secure solutions or offer assistance in navigating the secure platform. The decision-making process should involve a risk assessment of each communication method, prioritizing patient privacy and regulatory compliance as non-negotiable elements. Question 20. Governance review demonstrates that a patient who has previously received in-person care from a physician is now requesting a telehealth consultation for a new, non-emergency condition. The physician is willing to provide the service remotely. The patient has expressed general agreement to receive care via telehealth, but has not explicitly consented to this specific encounter or been fully informed about the privacy implications of transmitting health information electronically. Additionally, the physician's practice is located in a state that has recently updated its telehealth reimbursement guidelines for Medicaid patients, and the coordinator is unsure if the physician's current setup fully complies with the new originating site requirements. What is the most appropriate course of action for the certified telehealth coordinator? Option A. Proceed with the telehealth visit, assuming that the patient's general agreement and the physician's willingness to provide the service remotely are sufficient, and that standard HIPAA privacy rules will cover the encounter. Option B. Proceed with the telehealth visit after obtaining explicit, documented consent from the patient for the telehealth encounter, and verifying that both the patient's originating site and the distant site provider meet current Medicare and Medicaid telehealth eligibility requirements. Option C. Inform the physician that the telehealth visit cannot proceed until the coordinator can definitively confirm the patient's understanding of all privacy risks, even if it delays care, and postpone the visit indefinitely until all Medicaid eligibility nuances are resolved. Option D. Conduct the telehealth visit immediately, as the patient has a prior relationship with the physician and has generally agreed to telehealth, and address any consent or eligibility documentation after the encounter. The correct answer is B. Proceed with the telehealth visit after obtaining explicit, documented consent from the patient for the telehealth encounter and verifying that both the patient's originating site and the distant site provider meet current Medicare and Medicaid telehealth eligibility requirements. Explanation. Scenario analysis. This scenario presents a common ethical and regulatory challenge in telehealth. The coordinator must balance patient privacy and data security with the need to provide accessible care, all while adhering to the complex and evolving Medicare and Medicaid telehealth policies. The challenge lies in interpreting and applying these policies to a specific, potentially ambiguous situation, where a misstep could lead to regulatory violations, patient harm, or loss of reimbursement. The coordinator's judgment is critical in navigating the nuances of consent, data transmission, and provider eligibility. Correct approach analysis. The correct approach prioritizes obtaining explicit, informed consent from the patient for the telehealth encounter, ensuring they understand the nature of the service, potential risks and benefits, and their privacy rights. This aligns with fundamental ethical principles of patient autonomy and beneficence, and is a cornerstone of Medicare and Medicaid telehealth regulations, which often require documented consent for remote services. Furthermore, verifying that the originating site and distant site providers meet Medicare/Medicaid telehealth eligibility requirements is crucial for proper billing and compliance. This ensures that the services rendered are reimbursable and that the care provided is within the established regulatory framework. Incorrect approaches analysis. One incorrect approach involves proceeding with the telehealth visit without obtaining explicit patient consent for the remote modality. This violates the ethical principle of informed consent and directly contravenes Medicare and Medicaid guidelines that mandate patient agreement to receive care via telehealth. Such an omission can lead to patient dissatisfaction, privacy breaches, and regulatory penalties. Another incorrect approach is to assume that because the patient has a prior relationship with the provider, consent for telehealth is implied. Medicare and Medicaid telehealth policies generally require specific consent for remote services, distinct from general consent for treatment. Relying on implied consent is a regulatory failure and an ethical lapse, as it bypasses the patient's right to make an informed decision about their care delivery method. A third incorrect approach is to overlook the verification of provider and site eligibility for Medicare/Medicaid reimbursement. Telehealth services are subject to specific rules regarding where the patient and provider are located and the types of services that can be reimbursed remotely. Failing to confirm this eligibility can result in denied claims, financial penalties, and accusations of fraudulent billing, even if the patient received appropriate care. Professional reasoning. When faced with such a situation, a telehealth coordinator should first consult the most current Medicare and Medicaid telehealth policy manuals and any relevant state-specific regulations. The primary focus should be on obtaining clear, documented patient consent for the telehealth modality. Simultaneously, the coordinator must verify that both the patient's location, originating site, and the provider's location, distant site, meet the specific requirements for telehealth reimbursement under the relevant payer. If any aspect of eligibility or consent is unclear, the coordinator should seek clarification from the provider, the billing department, or legal counsel before proceeding. This systematic approach ensures compliance, protects patient rights, and safeguards the organization from regulatory and financial repercussions.